Thank you for your interest in Uresta. We appreciate you taking the time to watch this video. In this video, we will cover about Uresta and how it works, the fitting process, clinical study overview, who the perfect candidates are for Uresta, and who Uresta may not be a good fit for, how Uresta compares to other alternatives, health insurance, how to order, our Facebook community, and where to send your questions. We will also send you a copy of the slides, as well as a starter kit that you can use as a demo kit in your office and some brochures that you can provide to your patients. About Uresta. Uresta is considered a pessary by virtue of the way it functions. It's inserted vaginally and provides mechanical support to both the bladder and urethra to avoid unwanted bladder leaks related to stress urinary incontinence. Uresta was created by world-renowned urogynecologist Dr. Scott Farrell, who's the second licensed in Canada and seventh worldwide. He started his career focused on bringing innovation to surgical treatments for stress urinary incontinence, but realized a lot of women who suffered could be treated with pessaries and avoid surgical intervention. So that brought him to the world of pessaries, and he spent most of his career developing many of the most commonly used pessaries today, including the ring pessary with a knob. Ultimately, he saw a need for a different type of pessary that offered women a little more independence in managing this condition. Dr. Scott Farrell has published over 65 academic papers and textbooks. He's the former president of the SOGC and former professor at Dalhousie University Medical School. Uresta is a Canadian-based company. We're proudly women-owned and led and run today by our CEO, Lauren Barker. All products are manufactured at a leading medical manufacturing facility in Canada, and we are now available in Canada and the United States as an over-the-counter product. Uresta improves the quality of life by immediately stopping leaks. Uresta is a bell-shaped design, and the instructions for using Uresta are designed to be intuitive and accessible to people who are non-healthcare providers in lay language. This product is reusable, and we recommend replacing on an annual basis for hygienic reasons. Uresta is inserted vaginally, which provides that urethral support. We do recommend tucking the handle or the widest part behind the pelvic bone. This seems to keep the device snugly in place. The handle is designed for inserting and removing easily. The way Uresta actually works is it comes in 5 sizes. What we recommend for first-time users is starting with our starter kit, which includes the 3 most popular sizes, size 3, 4, and 5. Those 3 middle sizes fit approximately 90% of women. You can see in the picture the sizes are actually printed on the handle. So they start with the starter kit sizes. We recommend with the middle size, size 4. That way, if they need to dial down the support, they can try size 3. If they need more support, they can try size 5. If they need one of the additional sizes, they can just call or email us within 30 days of purchase, and we will send size 2 or size 6 complimentary with no additional taxes or shipping. What we find are 50% of women will wear Uresta daily as part of their regular routine, so they'll insert it when they wake up and take it out before they go to bed. 50% wear it periodically when they go to the gym or traveling, or even the week before their menstrual cycle when they might find they have more leaks. Nightly removal is not related to toxic shock syndrome, but allow a few hours nightly for tissues to rest and recover to help ensure healthy vaginal tissues over the long term. Cleaning is easy, just a mild soapy water, whatever has less chemicals, and it doesn't need to be boiled or sterilized. Uresta is made of a non-latex rubber. The technical term is thermoplastic resin, or TPE, which is a medical-grade plastic designed for long-term medical use in the body. Let's review next how the fitting process works in more detail. For finding the perfect fit, it boils down to one primary step, but 4 primary questions. Insert the middle size in the kit and answer these 4 questions while inserted. Is it comfortable? Is it stopping my leaks? Is it staying in place? And can I use the washroom comfortably without having to remove the device? If yes, she's found her size. If no, it's basically going up or down in size through a trial and error process to see what fits best. We recommend women viewing this as a process and to try these sizes specifically during times or situations where they commonly experience stress urinary incontinence. So for example, when they go for a run or at the gym, to make sure they find the fit that really works for them. We'll review the clinical trials and safety for using Uresta next. A little bit about safety and efficacy. Uresta is cleared by the FDA and licensed by Health Canada. It has undergone 4 clinical studies, including 2 additional ones that are on their way in New Brunswick, which is under peer review, and one at the University of Ottawa, which is still underway. That will bring the total to 6 studies, making it likely the most studied solution for stress urinary incontinence on the market. On the slide, this was a study from a few years ago in the UK. We reference it as it is the most recent and biggest sample size. What you can see from the results is Uresta will likely work for the majority of your patients. However, it will certainly not work for everyone. The one thing we do to help with that is offer a 30-day money-back guarantee. So your patients can try Uresta, and step one is to reach out to us to see if we can help them troubleshoot and find success. If we can't, we will fully refund them. Next, we will talk about some of the references in some of the big medical journals we get all over the world. We know that this isn't a medical journal, but we are recognized by the SOGC as the only product for female incontinence in that category. They also include references to Uresta by name in their treatment guidelines for the conservative care for stress urinary incontinence, which is something we are very proud of. On the right, you will see the fun side. Uresta does get some shout-outs, for example, in the Menopause Manifesto, which is a bestseller by Dr. Gunter. Let's review next who Uresta is a good fit for. This may look very familiar to you in terms of your own patient demographics. We see this being about an equal third split between the three categories here. New moms, we hope this is a temporary fix while they work on their pelvic floor therapy, but we see and hear and find many wearing Uresta provides immediate relief from their bladder leaks, which gives them the confidence to get back to their treatment. Active women are probably just more aware of the nature of the activity and experiencing their leaks, so we have lots of active women in our community. Our women 50 plus or our postmenopausal women, we do recommend inserting with a water-based lubricant for all, but after 12 hours we find it may have dried up. So we recommend for your postmenopausal women to check for severe dryness and atrophy before starting the process, as it will just make the experience more comfortable for them. We will mention who Uresta it may not be a good fit for next. If women are currently pregnant, we would suggest waiting until 3 months postpartum. Prolapse we did briefly mention. Generally, if patients have a grade 1 or 2, they can find a comfortable fit. Surgery, we ask to wait for clearance, and we talked about severe dryness, and currently, Uresta is not indicated for the use under the age of 18. Let's review Uresta and how it compares to other alternatives for managing stress urinary incontinence. This is a busy slide, and we will cover a high level here and send this information to you to do a more detailed review. The cost of the device for Uresta is $179 for the starter kit. That includes all the additional shipping and handling and taxes for size 2 and 6 if needed, and is fully refundable in 30 days if needed. Most find that Uresta is cost-effective and environmentally friendly option when you compare this to daily disposables. Often women don't calculate how much they're spending annually on disposables. When the user comes to replace her device, she can choose to purchase the single size or the annual replacement, or if she requires multiple sizes, we'd recommend the starter kit. One thing that we don't show here is pelvic floor therapy, as we are always encouraging women to seek treatment and see Uresta as a complement to pelvic floor therapy, not as a substitute. We work with a lot of physios across North America and see them using Uresta in one of 3 ways in their practice. Firstly, if you have a patient who's 98% dry and just needs a little support in those specific instances like running, Uresta may be used in those moments. Or 2, if they need a bridge. So if you have a new patient who wants to be dry by tomorrow, she can use Uresta to bridge until pelvic floor therapy helps to strengthen. This might be in a few months, and she'll get to the point where she no longer needs Uresta anymore. But in the meantime, she can use Uresta for that immediate relief. And lastly, the situation we see most commonly where pelvic floor therapists are using Uresta is if it's been tissue damage or a patient didn't find success with their pelvic floor therapy, Uresta is just another option for them to try. Prolapse, generally we find stages 1 to 2, comfortable fit, as I mentioned, and higher, more severe stages, it's really case by case. The other thing we want to note here is mobility and dexterity. Similar to a menstrual cup, they need to be able to reach around and self-insert and remove, knowing it's a process that they need to insert and remove twice daily. We will cover a high-level overview of insurance in Canada next. Majority of insurance plans do cover Uresta. As you know, with each plan, coverage can vary tier to tier. We suggest they check with their provider and ask if there's a classification of coverage for pessaries or incontinence supplies. We find some do require a prescription from a physician. So in those cases, we've had success with the physio connecting with the physician to write a prescription for the purpose of submitting for coverage. On the next slide, we will discuss the simple ordering process for Uresta. In terms of availability, Uresta can be easily purchased from our website, uresta.com. It ships from within Ontario, Canada, or in the US, Michigan. You can expect generally a 5 to 7 business day window for shipping, for delivery for the most part, and it is shipped in a discrete box. Clinics can carry Uresta, and if you are interested, let us know and we will help you set up with our retail program. Lastly, we will share information with you about our thriving Facebook community. This is our ever-growing Facebook community, and you are welcome to join it. We have many HCPs, but mostly women who have just purchased Uresta or have been using for the long term and are interested in supporting each other. We post a question of the week, we moderate the group and especially who's allowed in, and we also promote current promotions. Once a month, we will invite a subject matter expert in the group to speak on a related topic to pelvic floor health. Thank you for taking the time to review this presentation. If you have any additional questions we did not cover, feel free to email us at support@uresta.com.